Hello everyone, I am Kayalvizhi from the Department of Radiography and Imaging Technology, second year at SNS College of Allied Health Sciences. Here I am going to share my article about coronary CT angiography. An introduction about a CT coronary angiography is a non-invasive method to image the coronary arteries. It is less invasive imaging modality for diagnosis of a coronary artery disease like CAD and used to avoid coronary angiography in low and intermediate risk patients. The cardiac is highly motion due to physiological function, hence required for fast scanning mode. And the indications include chest pain, evaluation of chest pain in patient, suspension of coronary artery, pulmonary vein evaluation, evaluation of cardiac masses, ascending graft pulmonary and patency after prior bypass surgery, evaluation of aortic disease. Contraindications include COPD or asthma, hypersensitivity, heart block and hypertension. And for the procedure, the patient preparation is included as no food for 3 hours prior the examination, no caffeine for 12 hours, hydrate the patient, follow the medication and take pre-medication for renal protection as needed, and check urea creatinine level by institutional protocol. And ECG gating techniques are used to improve temporal resolution and minimize the image artifact caused by the cardiac motion. There are two types of techniques are used: prospective ECG gating and retrospective ECG gating. In prospective ECG gating, it is also known as a sequential or a cine-mode scanning, seeks to identify the areas of lowest cardiac motion and acquire image only in those portions of the cardiac cycle. Benefit: minimize the radiation exposure, whereas in the retrospective ECG gating method acquire images throughout the cardiac cycle while the patient ECG is recorded. Advantages: entire volume is acquired. Disadvantages: higher patient radiation exposure. Administration: most cardiac CT protocols require the IV administration of hydrogenated contrast agent. Intravenous access is preferably established in the cubital vein. An access site in the right arm should be chosen to prevent the streak artifact in the left subclavian vein interfering with the evaluation of a LIMA origin. 18 to 20 gauge or a large IV cannula for higher injection rate. I add a small note about the calcium scoring. It determines the location and extent of a classified plaque in the coronary artery. This is a helpful diagnostic tool by measuring the amount of calcium that builds up in the coronary artery. The amount of calcification on the cardiac CT is expressed as calcium score. Because of a coronary calcium measurement is done mainly as a screening examination to asymptomatic patient, the radiation dose is particular concern. Scanning parameters: thinnest possible collimation and the fastest gantry rotation is necessary. Timing the scan: an axial image is used to define a circular region of interest in a descending aorta. The region of interest is subsequently used to track the arrival of the contrast agent bolus to start the helical scan at the threshold of 180 HU. Descending aorta may be performed for bolus tracking because it is less likely for early enhancing vessels such as superior vena cava to affect the region of interest. Thank you.